Hello and welcome to the program. I'm Sophie Scott. Coming up, could a new drug reduce the damaging effects of a heart attack? But first, the latest weapon against Alzheimer's isn't a new drug, it's a new application for your smartphone. The app helps prevent the onset of the debilitating disease by helping people better understand the risk factors. And it's the brainchild of a group of Australian neuroscientists. Letitia Lemke takes a look.
It's the new computer game that's good for your health.
Brain App is all about trying to address one of the holy grails in preventative medicine, which is about getting people to actually change their behaviour.
The app is the latest tool in the fight against dementia.
You take a survey, it gives you the actions you can take to improve your heart health and your brain health. It gives people a chance to get reliable, scientifically based information.
It has games to keep the mind sharp and draws strong links between mind and body.
We now know that all of those risk factors that lead to heart disease and heart attacks and heart damage are also risk factors for dementia and brain disease.
Despite decades of research, there's still no cure for dementia. But what scientists do know is that we should be thinking about dementia while we're still healthy.
Those changes that lead to dementia, they start 20 to 30 years before the onset of the disorder. So we're talking about doing the right things in one's 30s and 40s to protect our brain in our 60s and 70s.
To give ourselves the best chance of fending off dementia, the app suggests taking up a new hobby, exercising for 30 minutes a day and eating well. The Brainy app isn't a silver bullet for dementia. Many healthy people will still develop the disorder. But with disease rates expected to quadruple over the next 40 years, researchers are urging Australians to act now.
Australia's biggest study of lung cancer data has found disease rates are rising dramatically in women but are falling in men. The Australian Institute of Health and Welfare has analysed 25 years of information, and it's found more than a third of women diagnosed with lung cancer were never smokers. Amy Bainbridge reports.
Sue McCullough is one of a rising number of women diagnosed with lung cancer. She's never been a smoker and was shocked when she found out she had the disease 8 years ago.
It's difficult because lung cancer has a big stigma. And usually the minute you say, oh no, I had lung cancer, oh, I didn't know you smoked. You go, no.
Sue McCullough grew up with parents who smoked, and this report shows hers isn't an isolated case.
So around about 65% of women can have their lung cancer attributed to smoking, which leaves about 35% that can be attributed to other causes, and those other causes may include something like passive smoking.
Data from 1982 to 2007 shows lung cancer cases fell by just over 30% in men, but rose by 72% in women. Cancer Australia says that's due to historical differences in smoking.
In the mid-60s, 1960s, the smoking rates for men started to come down, but women continued to smoke at quite high rates until about the 1980s.
Sue McCullough calls herself a cancer survivor and wants people to know the disease doesn't discriminate.
The image of a lung cancer person is not just, 70-year-olds that have been to clubs and have lived smoky lives.
Mortality rates for lung cancer are higher in Indigenous Australians, low socio-economic areas and remote areas.
The Australian Medical Association has delivered another grim assessment of public hospitals. In its annual report card, the AMA found hospitals are still struggling to meet demand despite extra Commonwealth funding. The number of beds per capita continues to decline, while waiting times for elective surgery are getting longer. Rebecca Barrett reports.
It's another bitter pill. Australia's public hospitals are overcrowded, under-resourced and poorly managed.
And sadly our report card again has shown that there's been a deterioration in the amount of care being able to be delivered to our patients.
The AMA looked at 3 key indicators of performance: bed numbers, waiting times for emergency departments and elective surgery. In 2009 and 10 there was an extra 378 public hospital beds, but there are fewer beds per capita, and that means longer waiting times in emergency departments and for elective surgery.
So far, we're actually slipping back. We're not going forward. We'd like to see new beds.
Around the country, New South Wales suffered the biggest fall in bed numbers, down 197. South Australia was the only other state to lose beds. The biggest winner was Victoria, followed by Queensland. The pressure on emergency departments continues to grow.
It's a lot of strain on a lot of people to get the work done and specifically to take care of patients in the way that we want to.
But the government argues the report is out of date.
I think the AMA have got in the habit of criticising and they have forgotten to acknowledge good news.
The government says there's plenty of it: extra beds, doctors and nurses, and an increase in organ donor rates.
Doctors may have come up with a way of reducing the damage from heart attacks. They've developed a new drug which is about to undergo human trials. Researchers say tests on mice have been encouraging. When someone suffers a heart attack, a gene is switched on which damages the heart muscle. Scientists at the North Shore Heart Research Foundation have found that blocking the gene can minimise damage to the heart.
What we're doing is we're trying to reduce the injury that arises both from the heart attack itself and also the injury that arises from reopening the artery.
They've created a special molecule to switch the gene off. It can be injected directly into the heart while patients are being treated for a heart attack.
What we've shown in our study is that heart attack size is reduced significantly in those subjects that got the drug.
The study also found that the heart muscle recovered better from the attack if subjects were given the molecule.
28 people a day die from a heart attack in Australia. So there's an urgent need for new treatments to look at ways to reduce the heart muscle damage that can occur when someone has a heart attack.
Researchers say the drug is still a few years away from being used in the clinic, but the molecule is already being tested in human trials for other conditions such as cancer. A new report has found that more than half of those serving in Australia's Defence Forces have experienced a mental disorder. It's the first study of its kind worldwide, and Australia's senior military leaders have launched a fresh strategy to tackle mental health problems within the Defence Forces. Deborah Rice reports.
Around 30,000 personnel took part in the first comprehensive survey of mental health in the Australian Defence Force.
Having commanded a battalion on operations and have had soldiers from that battalion commit suicide in the intervening years, I wanted to make sure that what we were doing for our people was of the highest quality.
More servicemen and women considered suicide than the general population, but fewer actually took their lives. About 20% of ADF personnel had experienced a mental disorder over the year, no different to other Australians. But over a lifetime it leapt to 54%, significantly higher than the rest of the population. And it was the type of problem that set Defence Forces apart from the general population. Post-traumatic stress disorder was far higher due to their exposure to risk, and mood disorders, particularly depression, were more common, especially among the younger men.
Maybe it has got to do with the fact that, young individuals in the defence are asked to do difficult things and therefore maturing a little bit faster. We don't know. It's going to be an area that we have to look into.
The study concluded it was the level of exposure to trauma, not the number of deployments, that impacted most. But former soldier Moose Dunlop says many often don't reveal they need help for fear of letting down their team or damaging their career.
At the coalface or at the section commander level, we see very little change.
What we're trying to do is break down the stigma, partly by actually getting soldiers who've actually been treated, got better and are still at work, to tell others that it's possible.
More flexible management of recovery times is also being introduced, and Defence is doubling its mental health workforce.
It's a decision no woman wants to make, but according to new research, most would consider having both breasts removed if there was a high risk of cancer. The findings were released at the annual Pink Ribbon Breakfast. There's a special bond that runs through 3 generations of this Sydney family. They all carry the gene that puts them at high risk of breast cancer. Grandmother Val Vallis had breast cancer in her 40s. Mum Julie Ann Barter got it at 36. Daughter Krystal Barter knew the odds were stacked against her, so at the age of 25 she made a difficult decision.
I did a lot of research and then came to the conclusion that to defy my destiny, I would have a double mastectomy.
New research from Cancer Australia shows in the same situation, most women would make the same tough choice.
That was an emotional decision for me, but at the end of the day, I've never suffered another anxiety attack like I did, and my life is just, I feel like I've started a new life.
I went along with everything that they went along with because I wanted my granddaughter to survive. I didn't want to have another one in the family lose their life to breast cancer.
Having the gene for breast cancer puts women at an 80% increased risk of developing the illness. More than 14,000 women are diagnosed with breast cancer each year, but only a small number will get it because of their family history.
Our survey nationally demonstrated that 8 out of 10 women incorrectly assume that having one family member with breast cancer significantly increased their risk of the disease.
Krystal Barter doesn't know if her baby daughter Bonnie has the gene. Her hope is that by the time Bonnie wants to find out, medical research will have found a cure. A Sydney doctor banned from practising in the United States is being investigated by the New South Wales Healthcare Complaints Commission. Authorities say they're looking at the work practices of Dr Adriana Scheibner, who had clinics across Australia.
Would you like to wind back the clock and feel beautiful again?
This is the video which promoted the services of Dr Adriana Scheibner to Australian patients.
Her eternally young treatments are unique.
Now Dr Scheibner is under investigation by the New South Wales Healthcare Complaints Commission for alleged improper practices. She was the subject of similar complaints in the United States. According to the Medical Board of California, she surrendered her licence to practice there to resolve a disciplinary action. Despite those problems, she received a licence to work in Australia. Patient advocate Lorraine Long says medical boards knew about the complaints against Dr Scheibner and did nothing.
She should never have been allowed to practice. She should never have been given a registration certificate.
According to the Australian Health Practitioners Regulation Agency, there are a number of strict conditions on her Australian licence, including providing every patient with 2 preoperative consultations at least 10 days apart before a procedure, providing written information about the risks, and ensuring patients sign a consent form saying they're aware of the risks. The ABC sought comment from Dr Scheibner. Her lawyer, Bill Kalantzis, didn't respond to the ABC's questions. And that's all for this edition of the Health Quarter. Thanks for joining us. If you've got any story ideas or feedback, please get in touch on Facebook. Search for the Health Quarter page and click like if you want to be kept up to date. And I'll see you next time.